Welcome back to Healthwise. With me is Dr. Carl Gonsolin, and we were talking about pediatric care for the teeth, and he's a pediatric dentist. And Doc, it's summer, and you know, everybody's into playing and having fun, and the kids, the last thing they want to do is go to the dentist. Right. And I think the last thing the parents want to do is bring them to the dentist. What would you like to see as far as the parents and their taking care of their kids' teeth as far as pediatrics?
Well, you know, the summer, the routine goes crazy. And so we do want to remind the parents that the problems can still occur, the prevention still needs to be done. We want to make sure they don't forget about the brushing and flossing of the teeth at home and watching the diet. So they're still having a good time, but taking proper care of the teeth. But one of the things that occurs is that the parents, they're so busy, all of a sudden they realize school's starting, I need to get my kids to get their teeth checked, and they go to the dentist right before school starts. And there's a big rush of patients right before school starts. And if the child needs to have something, lots of times they can't get it done before the school starts, and then they have to miss school to get some things done. So we want to encourage the parents to get their kids to the dentist early so that there is something that needs to be done. It can be taken care of before school starts. And school starts now earlier than it used to be. I think it's around the middle of August, or earlier than that now. And so it's not that far away before school is going to be starting. So we do encourage that if they get that dental checkup in plenty enough time, that they miss the rush, so that if something needs to be done, they can get it taken care of easily.
Mm-hmm. Well, okay, let's talk about, I know a lot of kids now, and you're seeing kids with braces at a younger age.
Right.
What problems does that cause? I mean, you know, because braces, of course, you got this metal, and now they're not metal, you know, all the time anymore. I've seen them; they look like they're clear. I don't know what they're made out of, but they're clear. You know, they're not metal. But does that cause problems for dental?
Well, the major thing with braces is that you have to move the teeth. You have to straighten them out some kind of way. So something has to connect to the teeth to do that. And now you have something that can trap food, makes it difficult to keep these teeth clean. So proper cleaning of the braces is a very, very important thing to prevent, because you can end up with a lot of cavities while you have the braces on, or you can end up with, they starting to form a cavity, the braces are finished, now the teeth can be clean, but instead of having a nice white tooth, you have a tooth with a little white mark or several white marks on the tooth, and that's just something that else has to be corrected, and we'd like to prevent that. We want, you know, spending a lot of money to get the braces done right, you want those teeth to look good, okay? Mm-hmm. And so proper care of those braces is an important thing. Like I said, with the routine during the school time, it's a little bit easier to keep things in good shape, but you want to make sure that you don't forget to get those braces, to clean the braces properly after every meal if possible, brushing them well after every meal if possible, brushing and rinsing after every meal if possible. And it's really a good idea. We see a lot of kids that they're brushing, but they're not flossing. Now, it's difficult in some cases, or many cases, to floss, so you have to make sure you get good instructions on how to floss so that it can be done easily and correctly, and that can save a lot of problems, because you don't want to get cavities in between your teeth as well. Mm-hmm. So that keeping those braces clean is a major thing, and it's a lot more difficult, but it can be done, and once you get in the habit of doing it, it's pretty easy to do.
Right. You mentioned flossing, and well, two things I want to touch on. But first, let's talk about flossing. I know you've seen these little, they have all these gadgets now, something to make it easy. It's a little stick with a little, it's like a U with the floss between it. Right,
floss holder.
What do you think about that? Is that?
Well, we want clean teeth, okay? Flossing helps. The brush will clean part of the tooth. The brush will not clean all of the tooth because it can't fit in between the teeth. Mm-hmm. So you're leaving about 40% of the tooth, especially the back, completely unclean, mm-hmm. okay? So you can get a lot of problems, cavities and gum disease in that area just because it's not cleaned, okay? So that's where the flossing comes in. That's the thing that you can fit in between the teeth. So there are many kinds of ways of flossing. There are many types of flosses to use, okay? As long as it does the job, it's okay. The little holders can work well. As dentists, we're used to using our fingers, and we can get pretty good at it. Some parents have a hard time flossing their teeth. Some kids have a hard time flossing because they just mm-hmm. don't have the dexterity. So if they can use something that will make it easier to get the teeth clean, that's all we want. We don't care particularly you know, and it's best to get advice from your individual dentist. So what would be something that might look like it works good doesn't work well.
Right, right.
And so get advice from your individual dentist to find out what would work. Okay. Always easy to use the floss with your fingers because you always have your fingers.
Right.
Okay. You know, it's always easy to use the toothbrush. You don't need to have toothpaste. You can do it just as well without the toothpaste.
I was going to ask you that.
But you know, the brush will clean the teeth. I personally, when I brush my teeth, use toothpaste. I like the taste of it. I feel that it makes it a little bit cleaner, but in actual fact, it cleans just as well without the toothpaste if you do it properly, brushing and flossing, okay? Now, when you're brushing, when I'm recommending the parents brush the child's teeth, okay, I'm recommending don't use toothpaste. Or a tiny dab just for the flavor. It gets the child to cooperate better if he's a young child, okay?
Right.
All right? Because the child's got a mouthful of suds, he's choking all over the place. He can't cooperate, and you can't see what you're doing.
And you're not doing a good job.
And so then you're not going to stop the problems. You're going to miss the hard to get areas, which is the area that gets the problems easiest because it's harder to clean. Okay, and so my personal recommendation is not to use toothpaste when you're cleaning someone else's teeth. Okay, and it's the little ones. We don't want them swallowing a bunch of toothpaste anyway. And the fluoride that you have in toothpaste is helpful, but the clean tooth is what makes the difference, okay? And as they get older and getting the fluoride treatments at the dental office and the fluoride supplements, if they're in an area where the fluoride supplements would be a benefit, right? Then those help reinforce it, but you still can't get away from brushing and flossing. Just the daily maintenance is what's required.
What about rinse? You mentioned rinse. What's the benefits of rinse?
Well, with the little one, when you're gonna clean your teeth with brushing and flossing, you're gonna loosen up the plaque, which is germs from the teeth. You're gonna get it off the tooth or something like that. Now, it's not a bad idea to get that stuff out of the mouth as much as you can, okay? And so the rinsing can do that, okay? All right. And that just flushes as much of the bacteria out of the mouth. You don't get it all out, but and next day it's gonna be back again, okay? But at least it slows them down a little bit. Now, a little one, they can't rinse. They can drink water, good, okay? They don't need to use mouthwash. Most mouthwashes I'm not in favor of because of the alcohol content, and they don't work as well as you think they. They're not quite as well as the advertisement says, okay? All right? But brushing, flossing, rinsing, that is a good combination. With, you know, brushing first or flossing first, it doesn't matter, and rinsing last, okay? Now, when you're at a place where you can't clean your teeth, let's say you're out on a picnic or you're out on a meeting, eating somewhere, you can get a little bit of water, swish around a little bit and swallow, swish and swallow. That just gets the stuff out of the mouth, keeps the mouth a little bit cleaner, makes it that much harder for the problems to occur. When they have braces, that certainly can help. Okay, it's a little bit more problems with braces because there's so many areas that the food can get caught in, but it helps some. The best thing would be is to do what you can to get the teeth brushed and rinse good after that, and then later on when you're at home you can get the full cleaning done at home, you know. But that the rinsing is an important part to kind of add to what you can do when you're not normally in the place to do it right. Okay.
Well, we'll come back and we'll talk a little bit more about this and what happens in school when, you know, what parents could do in school as far as prevention and stuff after this brief break from our sponsors.